Dr. Narang and Dr. Nawad has covered a large part of what I wanted to say. But I think so I would just, elaborate some things more on the one is the utility and sometimes the futility of using BMI. Remember that obesity is a lifestyle issue. It is not, not merely related to just an excess calories. Encompasses many things. It may encompass personal behaviors. It may encompass levels of physical activity. It may also encompass ease and accessibility to food. Do remember that access to good quality food is not so easy. It's always easier to pick up a packet of chips, a packet of biscuits, and and you know do that while you're traveling or you're in a place of work or in your offices. It's much easier to get access to a banana, an apple, or an orange, or cucumber, or a salad for your meals. So that's one of the problems. That's why we call it a lifestyle disorder. It is something that we are continued to expose to from childhood to adulthood. We always have access to food that seems very cheap. It seems very accessible. That's easy to take, and and you're forced to live the way you are. So obesity essentially has become a modern lifestyle disease, and like everybody said, it is progressing to the point that it starts from childhood, and it's very difficult to get rid of. Remember that obesity has many things that that make it difficult for us to treat it, because it's not something that you report, right? It's just sort of like a tick box that you say he's obese, but what are you doing about it? We are really, as doctors, not being able to systematically address this issue. And this is something that we address only at the very late when they are morbidly obese. People come for bariatric surgery. They're coming to endocrinologists because they have developed diabetes. They're coming to us because they've developed heart problems, stroke, heart failure, so many things. But we're not addressing it early on, and that is something that we really should work upon. And that will obviously encompass all these things that we have talked about. So it is an inflammatory state, and that fat has different components, and some fats are good, some fats are bad. Remember, how we assess it is also something that we are learning to do now. BMI is what we use, but like we said, BMI cannot be an absolute tool, because what does that say? It just says height and weight, right? And weight doesn't get taught which type of weight. Is it muscle mass or is it fat mass? So, weight can be, for example, they can be a wrestler who has got a lot of muscle. Muscle has weight that's more than the weight of fat. So his BMI may be 25, his BMI may be 26. So that is not accurate, because he's muscular. Whereas there's another person who's an elderly gentleman whose muscle mass is less. His BMI may be normal, but he's making up that he falls within the normal, because his muscle mass is less and it's all made of fat. So his BMI may be normal, but he may not be well. He may not be healthy. So because it's all fat. And the distribution of fat is important. We didn't understand which all fats are, locations of fats are good or bad. Generally, fats around the belly is not good fat. Because that fat, one is the ones you can put in your abdomen. That is subcutaneous fat. But there's a type of fat that lies around our organs. That's called visceral fat. Some amount of visceral fat is good. There are types of visceral fat that are bad, that are inflammatory and lead to all sorts of conditions. Then, like we said, we can have heart diseases. You can have various types of cancers, all types of endometrial cancers. You can have breast cancers. You can have colorectal cancers. You can have gallbladder cancers, and all the works. And many other, muscular disorders, skeletal disorders, cardiac, neurological. So many things are affected by obesity. And therefore the treatments are very difficult, but do realize that obesity is something that people don't really come up to us to ask, what can we do? And that is something where nutrition plays a key role, physical activity plays a key role. Remember that all obese are not necessarily bad, as Dr. Nawal said. People, if they can be healthy, while they're obese, they may be physically active, and that's a stage when it's reversible. You can get rid of it, and getting rid of it is never too easy, because the body militates against you when your sugar levels are low. When you take a low-calorie diet, what happens is that your body hormones surge and work against you, and sometimes very difficult for you to maintain what is a optimal weight. The body sort of pushes you back into obesity, and that is something that has to be done systematically with the help of everybody. It's not a personal disorder. We sometimes take it as a stigma that guy is obese and it is his personal problem. It's not his personal problem alone, because the society in some ways has contributed to him becoming what he or she has become today. So, but yes, it is very important that we systematically address it. We take care that in the families, everybody is involved in the game, that we cut off calories where they are not necessary. We eat food that's healthy. We access food that's healthy, and we make sure that healthy food is available in our environment. Remember, it's very strange to see that in the less privileged environments, often you'll find more obesity. And the reason for that is no departmental store will open up in a under privileged area, because you can't sell fruits and vegetables over there. But it's easy to sell a packet of chips, a packet of biscuits, a Coca-Cola, or a beverage, a carbonated beverage over there. So these are things that we all need to address. It is something that is society's responsibility, that we address obesity as a whole, as a complete package, and not as an individual's personal problem.
Good afternoon all. So you might be wondering what I am doing here, because we are talking about the oil. हम तेल की बात कर रहे हैं, but तेल से भी stress का relationship होता है, and we call it oxidative stress. You all know that. But no, we talked about obesity, BMI and all that, but it's important to understand obesity and the risk of the oil is much more than BMI, what Dr. Nitish has pointed out. And the stress has a major role in obesity also, plus other health factors also. I will just give an example. A lot of time it happens that our diabetes endocrine people, our colleagues, they send the patient to us because they have used all the medication for diabetes control, but the patient not responding, and still diabetes not controlled. And that is mainly because of the stress. So the stress, you all know, when our body's resources is not able to cope with what the body or brain's demand is, then there is a mismatch. And that mismatch is the stress. So stress is not basically external, it's internal. It's your mismatch, not the mismatch of the environment. So the stress is so important. Like, if you do some, we have seen some studies and research, it's almost established clear that a lot of obese people, they are not overeater, but still they are obese. And that is because of the stress factor. Because what happens with the stress, if the stress is there and that is not controllable stress, that leads to increased level of glucocorticoids. तो जब भी cortisol बढ़ता है blood में, तो sugar भी बढ़ता है and fat release होता है. So once the fat get released, that get deposited, and what we have mentioned recently, the truncal obesity. So one of the important signs of the stress-induced obesity is truncal obesity, and that we can perhaps pinpoint if the stress is there. Another important study that has been conducted is like half of the patient who had the stress-induced obesity, that can be basically ruled out, and that can be ruled out by just simple test like hair cortisol level. तो हम हेयर का सैंपल लेके कॉर्टिसोल लेवल देख सकते हैं, तो जिसमें कॉर्टिसोल लेवल हाई होता है, तो दैट मीन्स कि द चांसेस ऑफ द स्ट्रेस इंड्यूस ओबेसिटी इज मच मोर, एंड अनलेस वी कंट्रोल द स्ट्रेस, सो द मैनेजमेंट परहैप्स विल बी डिफिकल्ट फॉर द ओबेसिटी एंड अदर फैक्टर्स दैट इज रिलेटेड टू दैट लाइक डायबिटीज, hypertension, and so many. What we see, like emotional eating is much more. And mostly the comfort food what Dr. Nitish has mentioned. So those food which is comfortably available. And most of these are processed food. And when we take high glycemic food, as a processed food, the obesity is more because there is a more and more sugar and the fat. So in emotional eating, mostly we eat the comfort food like chips and all processed. In fact, the cereals and a lot of the promoted cereals in the television for the weight loss, they also are high glycemic. So people keep on picking that, but there's a chances that no, glycemic index is high and might not be losing the weight, you are gaining weight in fact. So it is very commonly seen that if somebody's mood is low, the appetite also changes and you feel good. When you eat a lot, you feel good, and that also leads to emotional eating. And that no should be considered when there is obesity. There is a frequent misconception about the diet, but mostly it is seen that when you do the dieting, there is a very high chance of rebound weight gain. And that happens because body is not able to understand, because body has the mechanism to restore the food when the body understands that it is stopped. So once you are dieting, body is not able to understand that food is not available because of dieting or because of actually the starvation. So it stores that low carbohydrate and there is more muscle wasting in fact, so that energy can be there. So these factors are there in terms of the stress and mental health. So that also should be considered. To manage the stress precipitated weight gain, I would suggest 4-letter word, that what we call CALM, calm. Calm means connectivity, both emotional and social. A means activity, physical activity, mental activity. You have to be active in fact, so that more calorie can be burned. And L is learning new things, so that if you are active, you will learn something new. And the last is M is mindfulness. That means focus. Mindfulness does not mean meditation. If you are focused on anything, that means no, you are focused and your health is good.